Many people are confused about the concept of integrative medicine, and so today I hope to alleviate some of that confusion for you. Integrative medicine is a distinctly different medicine from complementary and alternative medicines. Rather, it is a complex marriage of traditional Western medicine and complementary therapies, such that it is holistic in nature, encompassing all aspects of an individual's being, whether it be their physical self, their emotional self, their psychological or their spiritual self. And as such, there are many different aspects of integrative medicine, ranging from simple treatments, or sometimes not so simple, as in lifestyle changes, the identification and treatment of possible nutritional deficiencies, the use of herbal medicines to support natural body processes, and many other modalities, ranging right through to our conventional medical therapies, where we use chemotherapy or surgery and the like. It is important to realise that integrative medicine is both a science and an art. It is really essential to accurately diagnose and identify and diagnose and therefore treat serious medical and or surgical conditions with conventional medical therapies when they're necessary as the first line of treatment. Now, these therapies are often faster acting and they have stronger effects. So if I'm going to walk into emergency with a heart attack, I'm not going to go and ask for a cardiac diet and fish oils and meditation. But it is ironic, however, that sometimes people need such hammers in order to actually reevaluate their lives and institute different changes, their lifestyle, their diet, and decide whether they wish to use nutritional supplements or herbal medications or other modalities in order to prevent such an event happening again. What is important also to understand is that diseases do not suddenly appear overnight. And this is particularly in the case of many chronic diseases that have reached almost epidemic status, such as type 2 diabetes, cardiovascular disease, obesity, and depression. So when we look at health, it's important to understand that really it's a spectrum from wellness through to dysfunction and ultimately through to disease. Now, it goes without saying that ultimately all of us would like to be in the optimal state of both physical and psychological health throughout our entire lives, but as we all know, this is often not going to be the case. So ideally what we want to do, and often what we can do, is be able to identify and recognize these body signs where our body lets us know that something is not right. There's some form of imbalance or dysfunction happening. Now, these signs might be quite subtle, such as a generalized vagueness or fatigue or restless legs or gastrointestinal disorders and so forth, but they are important all the same. And this is really where the other aspects of integrative medicine take place. It's important also to realize that when we use pharmaceutical medications, this does not automatically negate the concurrent use of other modalities such as dietary modification, herbs and nutritional supplementation. It is important to be aware, however, that there can be certain drug, nutrient and herb interactions that can occur. And this is why it's very important for you to discuss this with your integrative health practitioner. Now, many practitioners are very aware of the negative interactions that can occur between different drugs and nutrients and herbs. However, there is a growing body of evidence to suggest that many herbs and nutrients can actually work synergistically with these drugs. So hopefully, when used in combination, they can reduce the side effects of these drugs. And when we're looking at the well-being of a person and we're wanting to hopefully reduce side effects by being able to reduce the dose, as long as we achieve the same desired effect, then I think we're doing a fantastic job. A really good example of this is type 2 diabetes. Certainly if a patient has uncontrolled blood sugar and or insulin levels, well, there is a need for pharmaceutical medications. However, there's so much evidence now that the different nutrients such as magnesium and chromium and zinc and herbs such as gymnema and fenugreek can certainly help synergize with those drugs, and we can reduce the need for those drugs. And as I said, that's so important when we're trying to increase the well-being and the autonomy of that person. Some pharmaceutical drugs, unfortunately, deplete certain nutrients in the body. A good example of this, perhaps, is when the statin group of drugs, which is sometimes necessary to reduce high cholesterol in a patient. When we use these particular drugs, these HMG-CoA reductase inhibitors, they unfortunately block the production of another very essential nutrient in our body called coenzyme Q10. And this particular nutrient is not only important for our cardiovascular health, but is important for so many different other aspects of our body systems. Somebody once said, you can't walk into an art store and simply buy a variety of paints and come home and expect to create a masterpiece. And so in a similar matter, this is the art of integrative medicine. Integrative medicine is patient-centered and not disease-centered. It has the ultimate aim of creating wellness in that patient and not simply managing the symptoms of disease. And as such, the concept of integrative medicine is extremely important for every individual, from the health of our children all the way through to the health of our elders. So learning to identify and respect ourselves through taking active responsibility for our own lives are essential tools in creating optimal health and happiness for all. This is Dr. Lily. Thank you for your time.